my dog for comfort today.
Okay. So hello, my name is Cassidy and I'm going to be your student nurse today. Today I'm going to be performing a cardiovascular assessment on you. So first I'm going to perform hand hygiene and clean off my stethoscope. Next I'm going to ask you to lay down for me. Okay, go ahead and turn your head to the left for me. So I'm inspecting her neck. I'm looking for any signs of JVD, also known as jugular vein distension. I do not see any pronounced distension or abnormal pulsations. Everything looks normal and I don't see any signs of JVD. Okay, you can sit back up for me. Next, I'm going to palpate the carotid arteries. I'm going to do this one side at a time. I'm going to start palpating the left carotid artery. Pulse is regular and I grade it a +2. I do not feel any thrills. Again, carotid pulse is regular and normal, and I would rate it a +2. And again, I didn't note any thrills upon palpation. Next, I'm going to listen to the carotid arteries. I'm going to use the diaphragm as well as the bell. I hear air moving in and out of the trachea, as well as a normal pulse. I don't hear any bruit or turbulent blood flow sounds. I'm going to do the same thing on the other side. Again, I hear air moving in and out of the trachea, which is a normal finding, and I hear a normal pulse rate. No bruit and no turbulent blood sounds. I'm going to listen with the other side of my stethoscope. Again, I hear the same findings as I heard with the diaphragm of my stethoscope. Everything is normal. Next, I'm going to move on to inspection of my patient's chest. I'm looking for any heaves or lifts or abnormal pulsations, which I don't see. Everything appears to be normal. Next, I'm going to listen to the aortic, pulmonic, tricuspid, and mitral valve. I'm going to listen to the aortic valve, which is located on the second intercostal space just right of the sternum. I hear S1 and S2, the lub-dub sound, with no additional abnormal heart sounds. I'm going to listen to the pulmonic valve, which is second intercostal space just left of the sternum. I hear S1 and S2 lub-dub with no additional abnormal heart sounds. Next, I'm going to listen to the tricuspid valve, which is the fifth intercostal space, just left of the sternum again. I hear S1 and S2 with no additional heart sounds. Next, I'm going to listen to the mitral valve, which is located at the fifth intercostal space, mid-clavicular line. I'm going to ask my patient to lift up their breast.
Let's lift up my shirt.
You don't have to if you don't want to. Okay. Is that okay?
Good.
I hear S1 and S2 with no additional heart sounds. Everything is normal. Next, I'm going to move on to assessing skin temperature. I'm going to use the back of my hand. Skin is warm and dry bilaterally. And I'm also noting the color of her skin, which appears to be normal for her ethnicity. No signs of cyanosis, jaundice, erythema, or pallor. Next, I'm going to palpate the radial pulses bilaterally, which is on the thumb side of the wrist. I'm noting the rate and the rhythm. Radial pulses are equal and strong bilaterally. I grade it a +2. Next, I'm going to palpate the brachial pulse bilaterally, which is on the medial side of the arm. Pulse is equal and normal bilaterally, and I'd grade it a +2. Next, while I'm palpating the radial pulse, I'm going to listen to her heart and make sure that the rate and the rhythm is normal upon listening and palpating. I hear equal rate and rhythm while listening and palpating the radial artery. Everything corresponded. Next, I'm going to inspect the nails, and I'm going to check capillary refill. Capillary refill is brisk, less than 2 seconds, which is a normal finding. I'm next going to check for clubbing of the fingernails. I don't know any roundness, and the angle of the nail bed is less than 160 degrees, indicating no clubbing. If she did have clubbing, it could indicate prolonged inadequate oxygenation. I note that her nail bed is also firm upon palpation. Everything appears to be normal. Next, I'm going to ask you to lay down. Okay. And I'm going to pull up her pants. And I'm going to palpate her skin, the temperature of the skin, using the back of my hand. Skin is warm and dry bilaterally. It is slightly cooler as I move down towards her feet, which is a normal finding. And again, looking at the skin, everything appears to be normal. I don't know any cyanosis or unusual coloring. Next, I'm going to check for edema. So I'm just going to do this by pushing in on the skin, which I don't know any indentation or pitting, so no edema present. Next, I'm going to palpate the Pito Pulse bilaterally. Pito pulses are present and equal bilaterally. I'd grade it a +2. Next, I'm going to check post-tibial pulse, which is on the medial side of the malleolus, just behind it. Post-tibial pulses are present and equal bilaterally, and I'd grade it a +2. Next, I'm going to check capillary refill of the toes. So she's not wearing any nail polish, so I can go ahead and do it right on the big toe. capillary refill is brisk and less than 2 seconds, which is a normal finding and indicates that she has good perfusion. Okay, you can sit back up for me. And that is the end of my cardiovascular assessment. Everything was normal. Good job.